This is part 2 of Pediatric Emergencies all parents need to know how to intervene at home because it changes outcome. Please check the feed for part 1. Number 5 of the list of 8 is burns. If your child has a most common type of burn, thermal burns in kids are either hot surfaces or spilled hot liquids. The first intervention, the most important thing to do is cool the burn. Remove any hot or clothing, anything that's touched that was heated that touches the burn, and run under cool or tepid tap water. Cooling the burn as soon as you can dramatically decrease the amount of tissue damage and the extent of the tissue damage while you are seeking medical care. You can simply take dry gauze and soak it in room temperature or cool water, but cooling at home, first intervention parents should all know how to do if they have a burn. If your child has a burn. Second, bleeding. Your child has a laceration or a cut. Direct pressure and elevation while you are on your way to seek medical care, especially if it seems like a high volume or pulsatile blood, like they might have hit a blood vessel. Third is asthma. If your child has a wheezing event, has never had asthma before, and you have nothing at home to do, simply seek medical care as soon as you can. If your child has had wheezing and you do have medicine, starting albuterol, inhaled beta agonists at home, can significantly improve how they respond once they get to medical care and more aggressive interventions. And last 4 is seizure. Seizures in children come in 2 types. 1, your child's been diagnosed with a seizure disorder, you have medicines at home, and they have a breakthrough seizure or a prolonged seizure, and you have rapidly giving the emergency medicines. Those are usually nasal midazolam or rectal diazepam to break and stop the seizure before you seek medical care. If your child has never had a seizure before, seizures come in 2 types. They come in induced and non-induced seizures. The most common induced seizures are febrile seizures, and we can do a whole video just on this. But febrile seizures usually are triggered by an rapid elevation in temperature, usually from a mild illness. They usually resolve in a minute or 2. You should always seek medical care. The intervention is supporting their airway. Do not stick anything in their mouth. But watching their color and their breathing, and simply supporting their head so their airway remains in a neutral and open way while you are calling EMS. So I hope these help. Remember, knowing this and parental intervention can improve outcome.